It's summertime again, and a lot of us are coming back to power walking, running and training. One of the most common cases we see in the clinics is shin splint. So in today's video, I will talk to you all about what are shin splints. So shin splints are pain on the inner edge of your shin bone, which is the tibia. But pain can be anywhere from a few inches above the ankle and up to the knee. The term shin splints can also be called by other medical terms such as medial tibial stress syndrome. There are two types of shin splints: anterior shin splint, which is down the front of the leg, and posterior shin splint, down the inside of the leg. The signs and symptoms of shin splints are quite easy to recognize. If you are experiencing any pain on the lower leg on the either side of your shin after exercise, possible swelling, pain lasted a few days, then you're probably experiencing shin splints. Come and talk to us about your symptoms to confirm the diagnosis, and we can help you to get back to your training. One main reason why shin splints occur is due to poor mechanics of the foot with respect to the leg. This can cause muscle fatigue and overwork during activities. Poor shock absorption during activities with wrong foot type, footwear and poor mechanics can also be a cause of shin splints. Overpronations, oversupination, together with poor knee flexion and poor core stability can be another cause of shin splint. So most patients come to our clinic with shin splints have done some Google research on the immediate things they can do to reduce shin splints discomfort. So when you think you have shin splints, you should try to rest and ice the area directly after exercise for 15 to 20 minutes. Try to reduce the intensity, frequency and durations of your training. So you don't have to stop activities, just modify some of your training. You also should watch your training technique. Overstriding while you run or power walk is quite bad. And you should also talk to your podiatrist and physiotherapist about stretching and strengthening program to prevent muscle fatigue. Last but not least, you should be wearing supportive footwear while you train. So podiatrists are the primary health care for the lower limbs, so we're able to treat shin splints quite effectively. We can diagnose and examine shin splint, and treatment can include realigning the foot with respect to the leg to improve the efficiency of the mechanics. So what do you expect when you come to Sutherland Podiatry for shin splints? We will do a full biomechanical assessment such as your foot bones range of motion, muscle strength and flexibility. We also look at your feet while you weight bearing, and a gait assessment. At Sutherland Podiatry Centre, we will be able to give you the treatments and advice what to do for shin splints. Some of those treatments include footwear advice, appropriate stretches. We have 3D orthotic scanning and the latest shockwave therapy. So what are you waiting for? If you're experiencing all the shin splint symptoms or think you might have a shin splint, give us a call today on 02 9542 3491. Or if you like my video and find it helpful, please like and share or comment on our Sutherland Podiatry Centre Facebook page. Thank you for listening and happy feet.